Hi everyone, this is Rick McDermott with Senior Solutions Group, and welcome to our video on Medicare.gov. So we are going to discuss some of the most beneficial features of the Medicare government website and just kind of give you a quick overview on some of the features. We're not going to talk about all the features. We've been helping people with Medicare since 1995, and we've seen a lot of changes with technology over the years, especially the last couple of years with Medicare's website. So one of the things that you want to be aware of is the only time you can make sure that a website is an official website is by clicking this top button here. Here's how you know. If the website says official website, uses the .gov moniker, you'll see this symbol here and this symbol there, and that will let you know that you are on an official website. So if you go to a .com website that has Medicare in it, more often than not, then it's a 99% chance that you're going to go to a website that is a marketing website for an insurance agency or a company that is trying to sell you insurance. So Medicare.gov is the official website for Medicare. And one of the cool features on here is the feature that will let you log in and make sure that you are on the best plan for you so you can save the most money, and that is the objective. So what we're going to do is we're going to actually log in, and we actually help our clients log in to their Medicare website or even create a Medicare login. A lot of our clients who are elderly, either they don't have computers or they don't want to deal with this, ask us to help them. And Medicare has given us the green light to help our clients with this, with their permission, of course. So we're going to kind of go over some of the main features of Medicare.gov today. So the first thing I'm going to talk to you about is how to print your Medicare card. So if you lose your Medicare card, you can go into Medicare.gov. As long as you're logged in, you can type in your password and you can print your Medicare card, and you can also order a Medicare card. So you can click print my Medicare card, order a Medicare card. That way you don't have to call the 1-800-Medicare number and sit on hold for a half hour, 40 minutes, depending on how backed up they are at their call center. So if we order a Medicare card, we'll just click that tab there, and we will see that it will be mailed to your address within 7 to 14 days. So we're going to back out of that because we're not going to actually order the card. And we are going to go back to our account home now that we've, quote, ordered our card. Now we want to view our plan. So in this case, we're going to view the plan. So we want to compare our plan to all 2022 Medicare drug plans and or Medicare Advantage plans. So we'll click this Find and Compare 2022 Plan tab here. And we want to, in this case, we want to look for 2022 drug plans. We have the name of our current plan we're on now. Whether or not we qualify for extra help, in this case, we don't qualify for extra help due to low income. If you have questions about low-income extra help, let us know and we can talk to you about how to apply for that to help you save money on your prescriptions if you qualify based on low income. So we're going to click Part D. We can also click Medicare Advantage. So we're going to say Part D. We have our zip code in here automatically populated since we're logged in. Yakima County in Yakima, Washington, where we live. We'll hit Next. And Shazam, Medicare has a list of all of our prescription drugs that we've taken in the last 12 months. So we can edit the drug, we can also remove a drug. So if your doctor prescribed an antibiotic and you only took it once and you no longer take it, you can remove that drug. So we have 1, 2, 3, 4, 5, 6, 7 drugs in here. We can change the frequency by editing the drug. So if you only get one drug once every year, so if you only take it as needed, you can edit it based on how often you get it refilled. And you can also list the quantity. So Medicare isn't always 100% spot on the quantity, so you want to double check your quantity on your prescriptions to make sure they're accurate. But most of the time it is pretty accurate. So this is a big time saver because there are a couple dozen different drug plans to choose from. And what Medicare is going to do is it's going to rank all the plans based on your pharmacy and your prescription inputs. So we can add another pharmacy. We don't have to just compare one pharmacy. We can add mail order. We can put in another pharmacy here, Safeway here, Rite Aid there. We could add up to 5 total pharmacies. And once we've added all of our pharmacy options, we'll hit done. So this shows the current plan, the monthly premium, which is $11.60 per month, and your yearly drug cost at a retail pharmacy, which is $303.20. So the way they get to this $303.20 is they calculate your total drug cost for the year or the remaining months of the year, plus your premium per month that you pay to get to this number here. Most of the time, the mail order is going to be a little bit less than the retail pharmacy, but in this case, you can actually save money using a walk-in pharmacy versus the mail order pharmacy. And of course, the deductible may or may not factor in depending on what tier your drugs are in. So the standard Part D deductible for 2022 is $480. So if you're on an expensive drug such as Eliquis, you may have to pay that deductible up front before the plan kicks in. So when we hit plan details, we can detail it as far as what the copays are, what the deductible is, what the premiums are, and go month to month to month. So in this case, our current plan is through WellCare for $11. And what Medicare does is it's going to automatically show us all the plans ranked by yearly drug and premium cost. So up here, you can change how the plans are ranked based on lowest monthly premium, the lowest deductible, or the lowest drug plus premium cost. So you always want to make sure that you look at the total cost, which is the refills plus your premium to get the total big picture cost. You don't want to just pick the cheapest drug plan unless you're on no drugs or 1 or 2 generic drugs. So we have WellCare, $303.20 is the total cost for the year, and we're in the month of January, so they're really factoring in February through the end of December of 2022. The next plan is the $7.70 Silver Script plan, but you can see that the total cost is $438.98, which is over $100 more than the WellCare plan, even though the WellCare plan costs more per month. So we can compare up to 3 plans at a time. The next plan is Humana Walmart. So let's compare these 3 side by side by side. So all plans get Medicare star ratings up to 5 stars. Most plans have between 3 and 4 stars. You can see this plan is 3.5 stars. The middle plan, Humana, is 4 stars. And then Silver Script is 3.5 stars. And here's the monthly premium here, the deductible. 7 out of 7 drugs are covered by the plan. And here's your refill cost at each pharmacy. You can see Safeway is preferred in-network. Rite Aid is a standard pharmacy, so it's in-network, but you're not going to get preferred pricing at Rite Aid. Walgreens is a preferred pharmacy as well, and then you have mail order. You can see on Silver Script that Walgreens is out of network, and you can see the total cost is $9,428.82. Wowza, wowza, wowza. And then the Rite Aid would be $1,700. So you can make a big error by A, picking the wrong plan, or B, picking the wrong pharmacy. So it's important that you take the time to review your options on an annual basis. And you can use Medicare.gov as a tool. It's a great tool. So Safeway or Walgreens with WellCare would be our best option. and we can look at plan details. Again, here's our monthly premium. Here's our deductible, which we may or may not even satisfy, depending on what tier your drug is in. We have our preferred pharmacies listed here, and then you can get a readout of what each drug is going to cost you for the entire year in the next column. So the total yearly cost for the prescriptions is $175.60 for February through the end of the year. So you won't even meet your deductible in 2022 on this plan. So you can guesstimate your cost for your refills there for every 90 days, $43, $43, $43 in February, May, August, and November. So lots of good tools on Medicare.gov. So we can go back to the plan comparison. We can also compare if you're interested in Medicare Advantage plans. So in Yakima County, there are 25 different Medicare Advantage plans, and you can toggle back and forth between prescription drug plans and Medicare Advantage plans with a click of an icon. So WellCare compared to the Medicare Advantage plans, you can see the Medicare Advantage plans may have a zero premium, but you would have a out-of-pocket of up to $6,700 on this plan, and it is an HMO, so you must go to plan doctors unless it's an emergency if it's an HMO plan. But again, the same tool works for all the Medicare Advantage plans if you have Medicare Advantage plans available in your county. So that's the drug plan and the Medicare Advantage plan comparison tool on Medicare.gov. So there's a lot of other features you can look at on Medicare. You can check how to sign up for Medicare. So if you're already on Medicare, you're not going to need to sign up for Medicare, but you can go to Medicare.gov and not log in and find out how to enroll in Medicare, find out your Medicare cost. So if we click Medicare cost, we can find out what Part B costs are for 2022. Which in 2021, it went from $148 to 2022 up to $170.10. And there's been some debate in the last few weeks about whether they should lower the premium due to the new Alzheimer drug, Aduhelm, which you can check out our other videos on Aduhelm to find out why Medicare went up so much from 2021 to 2022. And if you have an adjusted income or an IRMA, you may have to pay more for Medicare, and those charts are listed here as well. So another feature on Medicare.gov is you can find out your Medicare rights. You can find out how to file an appeal if you don't agree with a decision that Medicare made or your Medicare Advantage plan made on a claim. So if you went to a doctor and had a procedure and Medicare denied that claim, you can file an appeal. You can also fill out a claim form under Medicare right here. If you don't get your Medicare card by the first day of your effective date and you need to see the doctor right away without your Medicare number, you can file a paper claim to Medicare, and this shows you how to do so. Most of the time though, you won't have to fill out any claims. 99% of the time ever on 99.8% of the time you won't have to do any claim work on Medicare. So you can also download your claims and your personal data. So if you want to review your claims over the last 12 months, 24 months, or 36 months, we're not going to do that right now, but you can fill out check the boxes of the claims that you want, and you can click on these boxes and review all of your claims over the last 3 years. So lots of great features. We're going to touch on a handful of them. So your claims, your premiums, your plans. So you can click on My Plans. If you lose your prescription drug card, you can print a temporary prescription drug card right here. And this will tell you your plan, your ID number right here, your group number, your RX bin number, and your RX PCN number. This is the information that your pharmacy is going to need to fill your prescription. You can print this out, take it into your pharmacy, and if you want to order a new card, a lot of the prescription drug plans are using overseas customer service when you call the 800 number, and often you have to sit on hold for a long time, you can log into your plan, create a username and a password just like you do for Medicare.gov, and print out a new card or order a new card or pay for your prescription drug plan premium as well. So there's lots of handy-dandy tools online that you can use with Medicare.gov. So you can also look at your previous plans, which you had. So if you have a claim from the previous year and you changed your drug plan from one year to the next, you can go see, well, what plan did I have before? Oh, I had this plan right here. I had the AARP plan up until the end of 2021. The other thing is that on occasion you may get billed for a late penalty due to not having a prescription plan. And sometimes there are errors or mistakes made. You can go to your history and find out what you had and when, and it will tell you if there are any gaps in your Part D drug coverage or not. You can also click the status of your new plan choice. If you selected a new plan during the annual election period, which goes from October 15th through December 7th. So there's lots of features on here that are really, really good. So you can also check to see if your doctor accepts Medicare. You can find care providers. You can compare procedure cost. So what would it cost to get what's a common procedure we want to look up? Cataract surgery. If you go to an ambulatory surgery center and you only have Medicare, no supplement, no Advantage plan, your estimated cost would be $316, depending on what part of the country you live in. If you go to an ambulatory surgery center. Now, an ambulatory surgery center is a non-hospital facilities where certain surgeries are performed. Or if you go to the hospital, it could be a part of a hospital where you get outpatient surgeries or services. You would pay an estimated cost of $524 if you only had Medicare. Now, if you had a supplement to Medicare, your out-of-pocket cost could be $0. So this is where things can really add up for people if they only have Medicare. So if you don't have a Medicare supplement plan and you only have Medicare, you could be out of pocket 20% of the bill. So this is the estimated cost of that 20% for a cataract procedure. So if you need a cataract on both eyes, you can multiply that by 2, and that would be your out-of-pocket cost. So there's a lot of features, and this kind of breaks it down what the doctor fees are, what the facility fees, what Medicare pays, and what your portion would be. So this would be 20% of the bill. Again, 20% of the bill, $524 of the $2,101 that Medicare actually approved of the bill. So there's the information on preventative care and lots of different features. Have fun with this. If you have questions about your options for Medicare, we are here for you. We specialize in it. We are a family boutique company. We treat you like we treat our mom and dad. And if you become a client with us, we want to take care of you for life. We're not here to make a sale. We're here to help you solve a problem. And that could be a problem making sure you're on the best plan, making sure you're not overpaying, making sure you're getting the most coverage for the least amount of dollars. We're here for you. And we care about you. And don't hesitate to reach out to us and subscribe to our channel if you haven't done so already. And please share this with a friend. Thanks so much and have a great rest of your day.